Good evening. I am Dr. Nakia Showell-Bart, pediatrician, child health equity researcher, and president of the Alpha Kappa Alpha Sorority Incorporated Upsilon Epsilon Omega chapter, proudly uplifting and empowering the Baltimore County community since 1994. We have partnered with Cade Foundation for the Maryland Reproductive and Maternal Health Equity Summit for several reasons. One, to continue to raise awareness of maternal health conditions that disproportionately affect Black communities across Maryland and across the country. To enrich our understanding of the social risk factors that contribute to reproductive health inequities. And finally, to be part of solution-oriented and inspiring discussions held with local and national thought leaders, including our very own chapter members, CEO of the Cade Foundation, Dr. Camille Hammond, Ms. Makita Scott, Delegate Jennifer White Holland, and Dr. Crystal Watkins. Such discussions will foster action towards enhancing access to reproductive health services and improving maternal health outcomes. Thank you.
Did you know that 1 in 5 mothers experience a maternal mental health condition and 75% never receive the treatment they need? I'm Dr. Gina McKnight-Smith, president of the Patapsco River, Maryland chapter of the Links Incorporated. Maternal mental health conditions are one of the leading complications of childbirth, and too often they go untreated. In Maryland, we're doing slightly better than the national average, but not by much. Our state received a grade of C on the 2025 Maternal Mental Health State Report Card issued by the Policy Center for Maternal Mental Health. A C means progress, but it also means too many women are still falling through the cracks. We can change that. By raising awareness, asking questions, and holding our leaders accountable, we can make maternal health a priority in Maryland. Because when mothers are healthy, families and communities are stronger.
Good evening. My name is Dr. Simone Gibson. I work here at Morgan State in the School of Education and Urban Studies, and I'm so excited that we have partnered with the Cade Foundation for the Maternal Health Summit, because the conversations that we're going to be having here are ones that, one, we don't have enough in our community, but two, it's important for especially our young folk here on campus to have this information so that they can have the knowledge to plan accordingly. So excited to welcome this conversation to Morgan's campus. Thank you.
Hello, my name is Janelle Rush, and I'm the very proud president of the Alpha Alpha Lambda Omega chapter of Alpha Kappa Alpha Sorority Incorporated, and we are proud to partner with the Cade Foundation for the Maryland Reproductive and Maternal Health Summit. This partnership reflects something deeply important to us, ensuring that women and families have access to the information, resources, and advocacy they need to make informed decisions about their reproductive and maternal health. We are proud to stand alongside the Cade Foundation in this important work and look forward to the continued impact we can make together. Enjoy.
Hello, my name is Devron D. Dickens Sr., Hallmark of the Baltimore, Maryland Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated, home of the 88th Grand Chapter meeting.
Greetings, my name is Josh Crockett. I currently serve as the first Vice Polemarch of the Baltimore, Maryland Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated.
And we are proud to partner with the Cade Foundation for the Maryland Reproductive Maternal Health Summit.
Because we know that healthy families are the foundation of healthy communities. Brothers of Kappa Alpha Psi Fraternity Incorporated are committed to being informed and engaged.
And more importantly, part of the solution for addressing maternal health disparities in our community.
And so, from the brothers of the benchmark of Kappa Alpha Psi Fraternity Incorporated, we say yo.
Hello, my name is Jan Wood Carter, and I serve as president of Alpha Kappa Alpha Sorority Incorporated Epsilon Omega chapter. We are proud to partner with the Cade Foundation for the Maryland Reproductive and Maternal Health Summit because we strongly believe in its mission. Raising awareness, providing meaningful information, and supporting families facing infertility and reproductive health challenges is critically important. Equally vital is our commitment to advocating on their behalf and ensuring their voices are heard.
Good evening, sorors, distinguished guests, and all who have joined us this evening. My name is Terry Scroggins, and I have the honor of serving as the president of the Baltimore Metropolitan Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Guided by our sorority's mission of sisterhood, scholarship, and service, and our steadfast commitment to uplifting communities through public service initiatives, this work is deeply rooted in who we are. We have partnered with the Cade Foundation because of our shared commitment to advancing equitable access to reproductive and maternal health resources, especially for communities that have been historically underserved. This collaboration reflects more than a shared mission. It represents a unified effort to educate, empower, and support individuals and families by addressing disparities in fertility care and maternal health outcomes across Maryland.
Hello, I am Angela Anglin, president of Alpha Kappa Alpha Sorority Incorporated, Alpha Gamma Chi Omega chapter serving Capitol Heights, District Heights, Kettering, and Largo in Prince George's County, Maryland.
And I'm Kim Taylor, also a member of Alpha Gamma Chi Omega chapter. I also serve in Maryland's House of Delegates, representing Prince George's County's District 23.
We are glad to be here today for our third year in a row co-sponsoring this worthy cause with the Cade Foundation and other collaborating organizations. This is the Maryland Maternal Health Summit, and it is so very important and vital to be able to talk about maternal reproductive health care. And the reason why is because we want to make sure we continue to educate, allow people to make informed decisions, allow people to be able to have safe health care, as well as just making sure that when it comes to health disparities among African American women, we are talking about it so people understand how it affects them.
Good evening. My name is Jonathan Sykes. I serve as the chapter president for the Pi chapter of Omega Psi Phi Fraternity Incorporated here at Murray State University. And we decided to partner with the Cade Foundation for the Reproductive and Maternal Health Summit because we really feel like it is important to uplift Black women. We feel like it is important to protect womanhood. And us as young Black men are going to do what we can to support those that we came from. Thank you.
I am Delegate Karen Tolles, and I am so pleased to support the Maryland Maternal Health Summit. It is a wonderful opportunity for women to get resources, to gain information, just to learn all the important, information there is regarding maternal health. And last year in the Maryland General Assembly, I had a wonderful opportunity to be the chief sponsor of a doula bill, which would make it easier for women and more comfortable for women giving birth, knowing they have a person in the room just for them, besides a spouse or some other individual. And so I am so delighted to be in support of this wonderful summit and ask that you all enjoy and have a great summit.
Hi, my name is Dr. Ivory Lipscomb-Warren, and I'm the president of the Northern Chesapeake Bay, Maryland chapter of the Links Incorporated and the chief operating officer of the Warren Foundation. We are proud to partner with the Cade Foundation for the Maryland Reproductive Maternal Health Summit because we are committed to ensuring that every woman and every family has access to care, support, and resources they deserve. This work is personal and purposeful, and we stand in advocacy, awareness, and action to help improve outcomes and strengthen families across our communities.
Hi, I'm Rod Harrison. I'm the pastor of Messiah Community Church in Reisterstown, Maryland, and we are proud partners with the Cade Foundation for the Maryland Reproductive and Maternal Health Summit because we believe that building healthy families is core to building healthy communities, and building healthy communities helps us build healthy cities and states and a healthy nation. And so we're delighted, honored, and proud to partner with them.
Good evening. My name is Yvette Hicks, and I'm president of the Baltimore County Commission for Women. And we have partnered with the Cade Foundation for the Maryland Reproductive and Maternal Health Summit. This collaboration reflects our shared commitment to advancing equitable access and high-quality reproductive and maternal health care. Together, we are raising awareness, addressing disparities, and advocating for improved outcomes for women and families across Maryland. Thank you for joining us.
My name is Deirdre Sumter. I am president of Xi Delta Omega chapter of Alpha Kappa Alpha Sorority Incorporated. Every woman deserves access to safe, equitable, and compassionate maternal health care before, during, and after birth. Xi Delta Omega chapter is teaming up with the Cade Foundation to make maternal health a priority. A leader in supporting families battling infertility and advocating for reproductive justice, together we're amplifying the voices of mothers, demanding policy changes, and creating a pathway for quality care for all. Join us in the movement for maternal rights, because healthy moms mean healthy communities.